And we go from an access and equity conversation around security and how that drives access and trust in the healthcare system to a discussion now around data equity and accountability for digital quality measures and API machine learning and AI decision support. And we're extremely grateful to have two leaders in that ecosystem, Judy Keen from Novartis and Holly Varnell from Dream Big Healthcare. Holly and Judy, welcome. Nice to see you both.
Hey, thanks, Dan. We're very happy to be here.
No, it's great to have you. And first of all, how are you and where are you both? Holly, you can go first.
I'm actually out of Denver, Colorado, and I'm doing very good. I'm glad to be presenting on this panel.
Fantastic. All right, Denver. And Judy, how are you and where are you?
Yes, I'm also doing well, and I am in Silver Spring, Maryland.
Fantastic. All right, good. So let's start with some introductions and just a minute or so about your backgrounds and your professional journeys to where you are today. Judy, if you could lead us off on that, that would be wonderful.
Sure. So I originally started out as a research scientist, but I got into kind of this digital medicine when I was working at medical associations, medical specialty societies, working on precision medicine, big data, things we were calling that. And now that's kind of moved and morphed into digital medicine, AI, machine learning. I'm thinking about how associations can what sort of role they should be playing in that field and how they can engage and how their role is in getting it into clinical care and clinical practice. I then moved over almost a year ago to Novartis to do that from the other side. So now partnering with medical associations in digital medicine and thinking about what sort of partnerships and what sort of connections do we need to make and collaborations do we need to have to bring digital medicine into clinical care and clinical practice.
That's wonderful. An impressive journey, no doubt. And Holly, give the audience a little bit of background on yourself as well.
Yeah, so I'm currently the executive director and lead consultant for Dream Big Health. We are a consulting group that believes in driving reform and equitable medicine with big innovations. With today's innovative healthcare landscape, we're trying to help new vendors, payers, health systems get into the market or expand their market, or even make sure that their products don't hold algorithmic bias, which I'll get into a little bit later. All of this kind of stemmed from my last initiative, which was driving equity for maternal health and childcare. And I've partnered with the National Institutes of Health with some large national leaders. And it's been wonderful just getting to know what we can actually do to start to solve some of these access and equity problems, and then trying to make a difference at the same time.
Brilliant. And again, really appreciate the time you're both taking out today to join us. And to start with, let's just start with some personal perspectives about some of the measures that you've seen that have been successful digitally to not only use apps that will help people manage their healthcare better, but also some of the digital health devices that you've seen improve access and equity for folks as Blair Hurst mentioned at the very beginning of the program, some of the folks that are sitting in low-income parts of America, whether rural, suburban, or urban. And Judy, we'll start it off with you, if you could address that.
Sure. I think we're looking at, incorporation of all sorts of different devices and ways that we can do better data capture, reach out to patients better. What ways can we engage people in a ways that we haven't before? And this obviously will just improve our data over time. I think, thinking about, wearables and those types of devices that are helping with detection of a variety of different endpoints in new and novel ways, and seeing what sort of data insights we can get from that we've never really heard before. We've been looking at, how do we develop new digital measures, and one of the things we've been doing at Novartis is working with the Digital Medical Society and coming up with novel digital endpoints. We've been working on a program with them. It's much larger, it's not just us, a much larger program where we're looking at nocturnal scratch and what sort of endpoints can we develop with those that will help with patients with psoriasis. And, I think we are always looking for those types of opportunities, always looking for ways that we can incorporate new apps and new devices that will help improve our data.
That's a great way of kicking that off. And Holly, how about yourself?
Yeah, so I'm a strong believer in digital measures and what we can actually do with them as long as we're using them in the correct way. I created some clinical quality measures around access and medical management and actual change in medical management for maternal health, or started to last year. And it's that's really important. We need to ensure, one, it's focused on something that will actually make a difference. So an actual change or an outcome change at the same time. But making it digital, we have the ability to start to work on those things that we know will improve quality and access now, but also risk stratify out some of those data points as we're gathering this information to learn new points of care and new pathways that we can help and diagnose earlier and sooner.
Okay, that's exciting. Those are both exciting areas. And I think one of the things that we're seeing as well is apps and some of those data sources that are driving certainly easier access for patients. Not all patients, certainly some, is in this area of being able to standardize some of this data. So it's easier for the providers that are trying to enable these technologies for these populations to get that done. And I will start with you, Holly, this time. If you could give us some perspective and maybe some case studies around what we could be doing as a healthcare ecosystem to make it easier for major system stakeholders like hospitals, health plans, life science groups to enable this kind of data access to patients through having standardized these sorts of formats and forms. What do you think?
Yeah, so I think one of the biggest parts is making sure that the apps actually harmonize with the systems that the providers and the health systems are currently using. I also think that there's the ability to create interoperable or structured clean data when you're building these algorithms for some of these apps. So it's actually pulling accurate information so the provider can trust, what it is that's being told to him from some of this awesome new technology that's coming out that helps us be a little bit more patient centric. But also I think that we need to start to look at some of the standards and giving guidance to maybe even the electronic health record systems and how they can vet through apps and pick through different remote monitoring devices that do enable better access to care. And just really trust, one sort of system on this is actually going to make a difference for my patients versus there's 20 million out there and they're all integratable with my electronic health record in my hospital system. And what do I do now? So I think it's really just coming up with a vetting process.
And Judy, what about yourself?
Yeah, I agree. I think, Holly, you're making some excellent points. I think the portability, what are ways that, patients are going to different hospitals or unfortunately having to go to different systems, how are they going to be able to bring their data with them and understand their data? I know I go on different portals for different physicians that I see and really kind of understanding what my data is and how, is there a way to be able to move that around? It's such a big issue. And I think what the efforts that the ONC, the Office of the National Coordinator for Health IT, are doing to make the interoperability part actually happen, I think are very important. Because I think, as you said, Holly, how do we have data available for patients in a way that they can understand it and then be able to have that be portable and accessible is really key.
Yeah, that is absolutely the cornerstone of the issue. Without a doubt, and without that, it really doesn't take off. And again, now starting with you, Judy, on this other issue that has been discussed throughout the day, but we're really holding out hope that artificial intelligence and machine learning and the algorithms that can come from that technology base will play a role in helping to either vet solutions or enable solutions that will help really respond to patients' needs and population health needs in a much better way, in a faster way, in a more efficient way. What have you seen along the lines of AI and machine learning doing that thus far?
In terms of like vetting apps and getting standardization of materials?
Yeah.
I think we're starting to see that there's groups coming together to be able to address these issues. It's not just going to be something that comes from physicians or comes from patients or comes from payers or coming from the government. I think everybody has to listen to what are the needs and what are the gaps. And I think we're starting to see that. We're starting to see there's information coming out from the government, what their expectations are. There's patient groups and medical specialty societies that are starting to think about, okay, what sort of things do our providers need? What sort of things do our patients look for? What sort of questions and what sort of answers do we need that will satisfy everybody? It's not going to be one group coming up with an answer and then being able to just push that out to everybody and everybody will be happy. We really need to work on this together. And I think this is, there's an area for a lot of the specialty societies and the patients group to be able to have a very big voice to say, here's some of the things that we need. We are a trusted separate entity. Our interest is for the patients and for the providers so that we can get the best care to people. And here are some solutions and here are some ways to vet apps in a non-biased way. And we have to also, as we're doing this and looking at what sort of answers do we need and what sort of gaps do we have, we also have to think about, okay, are we propagating any of the biases that were already there and any sort of things that have been historical in the data? Are we just making it worse, or are we just continuing it along as we're starting to move into these digital measures and a new way of looking at digital medicine? So I think that's all really important, and I think we need to start to do coalitions together to be able to make this happen, and I think we're starting to see that.
Brilliant. And we have about 1 more minute left for Holly. If you could answer the same question, that would be great.
Yeah, no, so I agree with everything Judy said. I think that we're coming together as groups and starting to incorporate like Z and V, ICD-10 codes for relational codes and social determinants of health, new value sets for that, and really trying to focus on specific populations. One thing to point out, which the FDA is addressing and doing a very good, starting to build a team to do a great job at this, is making sure that manufacturers with AI and machine learning are looking at the intended population as they're doing their clinical validations. And I think we have a lot to learn there. I think we'll learn real time from some of that and learn how to improve it, but I think we're on the right path.
Let's hope so. We certainly need it, and need it as quickly as possible. And if you two feel like we're on the right path, I feel like we must be on the right path. So really appreciate both of your times today. And again, thank you, Judy, and thank you, Holly.
Thank you so much.